let's talk about pain. I'm breaking one of the first rules I had for myself of making content, and that is that I'm recording in my car. I never wanted to do that, but I'm sitting here in the pickup line at school waiting for my kid to be done and scrolling like everyone does, and I saw a gymnastics video where someone posted something to the effect of, everyone sees the cool tricks and the cool flips, but they don't see the hard work and the effort and the chronic pain. And that made me want to cry, because that's not normal. I hate that anyone thinks that that's what gymnastics is. It's something that I am extremely passionate about, both as a mom of a gymnast and as a physical therapist myself, something that I tell my patients on a daily basis. Pain is not normal. I'm going to say it again. Pain is not normal. Your gymnast should not come home from practice every day in pain. Your gymnast should not feel like they have to tape their joints every day or they're going to hurt. That's not how it works. Pain is a symptom of something deeper, but it's not a sensation that you should experience on a regular basis. Now, let's talk a bit about what pain is and what pain is not. Pain is very different from muscle soreness. Pain, in my mind, is a very sharp, stabbing, I can't go on, this hurts kind of a sensation. Muscle soreness is a pretty normal thing for a gymnast and really not concerning. The only way to actually build strength is to tear your muscles down so that they rebuild themselves stronger than they were in the first place. And that's going to involve some soreness occasionally. So if your gymnast comes home from practice and her muscles are sore and she wants to take a hot bath, or she needs some extra water, or maybe a short walk to get some of that lactic acid out of her muscles, that's all a normal thing. It should go away within a day. It should never be even bad enough to require Tylenol, let alone anything else. But that's a part of getting stronger, and that's expected. Those sharp pains, those chronic pains where something hurts all the time. I can't walk normal because my ankle's sore, or my back hurts all the time if I bend a certain way, or something like that. That's not okay. And your gymnast should never feel that. Pain is your body's way of telling you that something is wrong. It's not something to ignore. It's something to pay very close attention to, because it's the only way your body has of saying, hey, you did something that hurt me. Could we maybe not do that again? And so when your gymnast starts talking about pain, you need to pay attention and you need to figure out where the pain is coming from and how to make it stop. Hiding the pain with pain meds or with ice is not ultimately going to be helpful, because you're not fixing the actual root cause of the pain. You need to find out what's causing it. You need to fix that. So there's two different types of pain. There's an acute pain, acute meaning it started within the last 48 hours. And typically that's going to be something that you know what happened. I fell and twisted my ankle. I slipped on the bars and I have a cut on my arm. Something like that. You're going to know exactly what happened. There's a reason that it hurts, and you can treat a very specific problem. And so there's nothing wrong with that type of pain, taking some pain medication while it heals. Once you know what's wrong, there's no reason to continue to be in pain just for the fun of it. Take the pain meds, let it heal. But that type of pain should be gone within 48 hours. It should not hang around. Then there's chronic pain. Chronic pain is the stuff that we're talking about. That's the stuff that we really need to pay attention to, and that should not be normal and should send up red flags all over the place in our mind when we find out that a gymnast has chronic pain. There are a couple of different pretty common causes of chronic pain in gymnasts, so let's talk about those real quick. The first one is hypermobility, meaning your body moves more than it should. And when your body moves more than it should, it puts too much strain on your bones and your ligaments, which are the pieces of connective tissue that hold the bones together. Those are not designed to actually bear weight. They're designed to provide support for your muscles to work against. But your bones and your ligaments should not be what's holding you up. And when you're hypermobile, your bones do more work than they should, and your ligaments do more work than they should. So that can cause chronic pain, and that needs to be addressed through some strengthening and some positioning stuff. The second one is hypomobility, meaning your body doesn't move as much as it should. You're not flexible. Maybe you just need some stretching. Maybe your muscles are tight. But when your body doesn't move as far as it should in one location, other places are going to move more than they should to compensate for the part that doesn't move, And that's going to cause pain because now you're getting movement in a spot that's not supposed to move during a certain activity. So that can cause pain. Usually that one's going to be treated with stretching and flexibility type exercises. The third one is weakness. If you're just not strong enough to do the skill that you're trying to do, you're going to cause pain because, again, as your muscles start to fatigue, all that weight gets transferred to your bones and your joints and your ligaments, and they are not designed to hold that kind of weight and that kind of pressure. And so you're going to hurt. And then the fourth one is just repeated impact. If you're doing all of those things, even if you do it properly, after a while, your bones are just naturally going to start compressing, and you're going to take a joint that's supposed to have space like this in between it and compress it where it only has space like this, and now you're going to feel like it's pinching. And the best way to fix that is just to stretch it back out, give it a break. Your body tends to naturally return to kind of a neutral state, and if you rest it for a minute, it should get better. But those are the most common. There are certainly other reasons that pain could be caused, but those are what I typically see in terms of gym injuries and then stuff I see with my patients. So how do we treat pain? What do we do with it? I'm going to suggest that taking pain meds every day, icing every day, and taping every day is a bad idea. All you're doing is hiding the pain. You're not fixing the problem, and you're going to make it worse. So when you have a chronic pain, something that doesn't go away, it's continuing to nag at you, you need to figure out what the underlying cause is. So if my ankle hurts all the time, does it hurt because it moves too much? Does it hurt because it doesn't move enough? Does it hurt because I'm too weak and I need to strengthen it? Or does it hurt because I'm just jumping too hard on surfaces that are not giving me enough padding and enough cushion, and I'm compacting my joint and causing injury that way? A good sports physical therapist will help you with that. I would not really suggest going for that on your own. Some professional help is probably a good thing to have in your corner. But don't look to your coaches for that. That's not their job. They're not therapists. They don't have the medical training of all of the muscles and bones and how everything attaches and connects together. And a lot of times, because of the way that our bodies are made, sometimes you'll have pain at one joint and the actual problem is in an entirely different location in your body, but the pain is presenting itself in a different spot. And so it takes some medical training and knowledge to dig down through the layers to figure out where that pain is truly coming from. The whole purpose of this video is that I want everyone to know that pain is not normal. If you feel pain, especially chronic pain, go get it checked out. Don't just live with it. Don't just ignore it. It's not going to go away. You're going to continue to get worse and worse injuries, and ultimately it could even prevent you from doing the sport that you love. If you end up with surgeries that require you to take a year off for rehab, that can be potentially career ending. If you can't do a certain event ever because of the pain that it causes you, nobody wants that. So please, please, please pay attention to your gymnasts as they're practicing, as they're exercising. The minute that they complain about pain, please take it seriously and don't just tell them to push through. And also try to figure out why. Don't just tape it and tell them to go on. Don't just ice it every night. Ice is really helpful for acute injuries in that first 48 hours. Ice is wonderful. After that, it really doesn't help. Tape, depending what kind of tape you use, there's kinesio tape and there's athletic tape. Kinesio tape is the really stretchy stuff that you see all over people's knees and elbows around their joints. A lot of athletes use it. The purpose of kinesio tape is actually just to lift the skin off of the underlying tissue and promote blood flow, which allows your body to heal itself better. Doesn't really provide a lot of support, maybe a little, but not much. It's not going to keep your joint stable. But if you're going to tape it, kinesio tape is the type that I would prefer. I actually put that even on a lot of my elderly patients just to promote blood flow and promote healing. Athletic tape is the real stiff, strong tape that will actually support a joint, which is great if your joint needs support temporarily. But when you continue to support a joint externally with tape, it shuts down your own muscles. Your body gets the signal that, hey, I don't have to pay attention to this joint anymore because they keep taping it, and the muscles actually stop working instead of getting stronger, and it'll make your problem worse. So be real cautious with that. Please consult a physical therapist, a trainer, a doctor, someone with training specific to that joint and specific to sports that can help you find the causes, because no one should ever live in pain, and gymnastics should not cause your child pain on a regular basis.